One of the muscles involved in facial expression is the epicranius. And so the epicranius is going to be the two bellies of muscle that we have, the occipital belly and the frontal belly. And these two are going to be connected then by this large tendon sheath, which is the epicranial aponeurosis. And so let's look at the two different bellies. So first, the frontal belly, which I'm highlighting here in blue. This is superficial to the frontal bone on the forehead. So when this muscle contracts, it raises the eyebrows and it wrinkles the skin of the forehead. Now here in orange, what we have is the occipital belly, which is found on the posterior side of the head, and when this muscle contracts, it retracts the scalp slightly. The orbicularis oculi are going to be the muscles that surround the eye. And so these are going to have a circular arrangement to their fascicles. And so when you contract this muscle, the eyelids are going to close like when you blink, wink, or squint. Your nasalis muscles are going to be superficial and they are going to elevate the corners of the nostrils. So these will go towards the sides when we are on the lateral portion of the nose and then go towards the middle, towards that glabella. And so these muscles, like their action, will be like with flaring your nose. The orbicularis oris will be the rounded muscle that will be around the lips and the mouth. And this, again, will have a circular arrangement for their fascicles, and this will be the encircling of the opening of the mouth. So when you contract this muscle, you will close your mouth. When you pucker up for a kiss, you are also using this muscle as well. The depressor labii inferioris will be a set of muscles that will pull the lower lip down. So part of this will be superficial and then part of it will be deep. So it will be superficial at this portion, but then underneath this muscle here is going to be deep. So this will be considered an intermediate layer. The depressor anguli oris muscles will be a set of muscles that we find at the corners of the mouth, and these are going to bring down that mouth so that this is considered our frowning muscle, bringing it down both in a inferior position and now lateral as well. This muscle is going to be superficial, and the frowning motion is due to the fact that it's going to actually attach at the skin of the lips, and so it's able to bring that down into that frowning motion. The levator labii superioris are going to be a set of muscles that are going to pull the upper lip superiorly and also will give flaring of the nostril slightly. And so this will be the Elvis lip snarl that helps to raise and furrow the upper lip. And a little bit of the flaring of the nostrils, because you can see here, is very close in proximity to those nostrils. And this muscle is going to be a superficial muscle. The levator anguli oris is going to be a deep muscle. And so in this image, it's cut here, and you see that it's going to be underneath the levator labii superioris, which is going to be this cut muscle right here. So the levator anguli oris is going to draw the corners of the mouth superiorly and laterally. And so this is one of our smiling muscles because it actually inserts into the skin at the superior corner of the mouth. The zygomaticus major and minor are going to be a set of muscles that will be close to the zygomatic bone. And so these will be a set of superficial muscles as well that will help to raise the corners of the mouth. So this is another muscle that's responsible for smiling, and it does work with the levator anguli oris in making that smiling motion. The risorius are a set of muscles that we find laterally and superficially. And these muscles pull the corners of the lips laterally because of their orientation, and so use these muscles if you make a closed mouth smile or a grin. And this will be a synergistic muscle to a zygomaticus, where it has a similar action as the other zygomatic muscle. Our mentalis muscle is a deep muscle towards the chin, so it will be towards the midline. And this attaches to the lower lip, and when it contracts, it moves the lower lip so that a person is pouting. The platysma, which is this large, thin muscle, is going to tense the skin of the neck and pull the lip inferiorly. And so if you stand in front of a mirror and tense the skin of your neck, you can see these muscles bulging out. So this is going to be a superficial muscle.